some adhesive so the PDS doesn't move from the tray. And remember, the only thing that I need to pay attention right now is the facial midline. So let me show you. I'm going to go like this, put the laser, and then just record that position. I don't care about the occlusal plane. I mean, obviously it will come close, but the only thing that I care is the facial midline. Okay, there we go. So I'm just going to use some Futar, quick set, so we don't need to wait too much. There we go, thank you. I'll go with the laser. And I only care, I don't care about anything else. You don't see that well with the lighting of the room, but my facial midline matches the laser. So now the only thing that I'm waiting is to set the PDS. Once the PDS set, I will remove it. And then we go and register the horizon in relationship with the natural head position of the patient. Almost there. And again, if you use the new 82 laser with the holder, the procedure is exactly the same. The only thing that you want to do with the laser is to register the midline. So this is set. I'm going to turn off the laser, remove it from the mouth. So I have my negative of the teeth. So now the only thing that I'm going to do is to recover the index ray. There you go. So this is ready. And again, don't worry about the plane. So the next step is I have the COIS scan body here. So I'm going to position the tray in the scan body. There you go. So it fits there and I'm ready. So I'm going to make Pamela more comfortable. We're going to make sure, remember, let me go here. This scan body has an F. F means facial. So don't get confused and change the orientation. You see the difference? So facial goes in the front. And then you have those vertical lines here that needs to match. So that means that it cannot be rotated, right? So the base, this line needs to match with this. And Jonathan did like a V shape here so it's easier to see. So those lines must match. Okay. So we're going to do the self-balance and the mirror technique. So you can put yourself more upright, there you go. And the same thing that we do always with the glasses. If you can hold my hand and position it in the right, oh, wait, I need to position the scan body. Sorry. It's like, what am I doing? So I'm going to make her bite the scan body with 2 cotton rolls, just to hold it. So I use my tray, one cotton roll on one side, one cotton roll on the other side, and then just close and make sure that it's all the way and seated perfectly. So now you can make yourself comfortable. There you go. I'm going to make my life easy, so I'm going to make sure that those lines matches here. So now I'm ready. There we go. So again, we go back with the hand. There you go. So look down, straight in the mirror, hold that position. Thank you. And then the only thing that I have done to do is just to level the bubble. And then Liz can double check with me. There we go. We match, the vertical lines are good, so we are good. So you can, you can relax, nothing, this thing is not going to move. So the most important thing is when you take it out from the mouth, the pivot cannot change the position. So I'm going to grab it from the base. That's why Jonathan did a huge base to hold it. So you go on to open, and then take it out. Thank you. So we have the scan body here. Wait, where am I? There we go. So I'm ready. So even if you hold it and move, the block is not going to change the position. So the only thing that we have left is to scan it. So let's use the trios to scan it, so we can show you how to digitize this in your practice. Remember, depending on the scanner that you have, life could be harder or easier. Trios is good, Medit is good. Aeroscan 3, I'm very shocked with this scanner, is really good. ITERO is not nice. PrimeScan can be challenging as well. So as you notice, I'm holding the scan body always for the base. You need to show that to your assistants because sometimes, they just hold it and then it's like you have to start again. So let me scan it for you. And again, in this case, as you're going to see the screen, you can do a scan only in the prescription of your intraoral scanner. Thank you. Let me see if I can show you from here. Do you have the remote, Jonathan, to show my scanning pattern on my hands or on the screen? Thank you, Jonathan. There you go. The other way. Let me take out the tray. There you go. Yeah. And then, yeah, that's perfect. And then take out the AI and the Caries 8. Thank you, Jonathan. There you go. I'm just waiting for Jonathan so you all see the scanning procedure. When I'm scanning, I'm holding the scan body in this orientation, not from the front or from the back. I love this base to hold it with my hands. And again, remember, I'm going to scan first the occlusal surface of the index and then the block. Opa. So there we go. I don't want to come back and fill any hole, so I'm just moving as I am collecting the information. Remember, in trios, you have the reliability function, so it's actually kind of nice. Maybe you also have it, you can go from red to green, so just move the scanner as you go, so you can capture the information. And again, now when I'm done with the index, remember, I don't need to have more than the occlusal surface. I'm going to move anteriorly, and I'm going to slightly move the scanner towards the anterior. So you can just go to the block and then move anteriorly. And then here you need to rotate the scanner. There you go. Slow motion always helps. And again, you don't need to scan the entire block, just the surface from the front. So I can connect from here and then the side. And again, once I have the block, I don't need any other information. I don't need the base, I don't need anything else. If I have an error here, I'm going to re-scan this corner to hopefully correct it. There you go, that's it. So I have the occlusal surface of the index and I have my cube. I don't need to scan more than that. And that's all that you need. With that information, it can be transferred, the maxillary scan, into the virtual articulator. Remember, I have the negative of teeth, so here I can superimpose the maxillary scan, and the cube has already the information of my occlusal plane, my horizon information in relationship with the natural head position. That is the reference plane that we use to transfer the cast into the articulator. Once you're done, you can just move the cube if needed, you can change the index, and you can reuse the Cohesive scan body system. And again, depending on the scanner, may be more difficult than others, but always the same scanning pattern. Always first the index and then the cube or the block. If you have the flat, you will do exactly the same thing. Remember, exactly the same protocol and exactly the same procedure. You will have the flat instead of the block. Yes?
What about the primes? You said the prime scan is tricky to